today is various types of joint and Hilton's law. So the competency we are learning today is various joints with subtypes and examples. A joint is the junction of two or more bones. Joint give movements to the body. Some joints are immobile. Sutures of the skull is an example of immobile joint. Sutures of skull help in the growth of brain. Classification of joints. Structurally, the joints are classified into three types based upon the binding material and presence of synovial cavity. Fibrous joints, cartilaginous joints and synovial joints. A synovial joint is a fluid, and a synovial cavity is a fluid filled sac present in between the articulating surface of bones. Fibrous joints classification. Fibrous joints are bounded by fibrous material. These joints are mostly immobile or provide only little movement. There are three types of fibrous joints. They are sutures, Syndesmosis and Gomphosis. You can see in the picture sutures which are present in the skull. So these are present in the vault of the skull. They are special for skull and are immobile. Then different types. Syndesmosis, another type of fibrous joint. You can see in the picture that is distal end of tibia fibula. These joints have fibrous binding material which is little longer than normal, and example is inferior tibiofibular ligament. Gomphosis. It is a peg and socket joint present between the socket for the tooth and the tooth itself. Then cartilaginous joints. In the cartilaginous joints, the binding material is the cartilage. There are two types of cartilaginous joints, primary and the secondary cartilaginous joints. First, we'll start with primary cartilaginous joints. These are bounded by hyaline cartilage. These joints become bone after 25 years. The epiphyseal plate of long bones and the joint between the first rib and the manubrium of the sternum are the examples of this type of joint. And in this you can see the joint that is present in the long bone, which is the primary joint. Secondary cartilaginous joints. Secondary cartilaginous joints, the articular surface of the bone are covered with hyaline cartilage. The binding material of the joint is fibrocartilage. The joints do not become bone even after 25 years. Movement in these joints is present throughout life. Examples are located in the midline of the body. Examples include intervertebral discs, pubic symphysis, joint between pubic bones, and the manubriosternal joint. So you can see the joint, secondary cartilaginous joints, that is between the pubic bones and the intervertebral discs. Then we come to synovial joint. They are the most movable joints in the body. They are classified into plane joint, hinge joint, pivot joint, condylar joint, ellipsoid joint, saddle joint, and ball and socket joint. Coming to synovial joint features. Synovial joint is surrounded by fibrous capsule, and this fibrous capsule is lined on its inner surface by the synovial membrane, except at the articulating surface of bones. Articulating surfaces are covered by hyaline cartilage. Joint cavity contains synovial fluid. Synovial membrane secretes synovial fluid for the lubrication of the joint. Nutrition of the cartilage is by diffusion. You can see in this picture synovial joint. There are two bones which are articulating, and the articulating bones are covered by hyaline cartilage. You can see that the bones are enveloped or enclosed in a capsule, fibrous capsule. On the inner side of capsule, it is lined by synovial membrane, and between the articulating bones there is synovial fluid. And the same thing you can see in another picture of synovial joint. Coming to plane joints, articulating surfaces are flat. Gliding movement occur in these joints, and examples are intercarpal and intertarsal joints. Then we go to hinge joint. Articulating surfaces are pulley-like, and they have strong collateral ligaments. The joint is uniaxial. Movements takes place in the transverse axis. Movements are flexion and extension. Examples of hinge joint are elbow joint and ankle joint. Pivot joint. In this, it has a bony pec which forms the axis of the joint. It is surrounded by osteofibrous ligament, as you can see in the picture. Bony pec moves to and fro within the osteofibrous ligament. Movements take place at the pivot joint are called medial and lateral rotation. The axis is vertical axis. Examples of fiber joints are the radio-ulnar and median atlanto-occipital joint. Then we go to another joint, that is condylar joint. Articulating surfaces of condylar joint are enlarged. For example, the condyles of the lower end of femur and the upper surface of tibia. Movements occur mainly in the transverse plane, but also little movement in the vertical axis. Besides flexion and extension, there is little medial and lateral rotation in condylar joint when the joint is in flexed position. And the example of condylar joint is knee joint. Ellipsoid joint. The articulating surfaces are elliptical. Movements occur in both transverse and anteroposterior axis. Movements are flexion and extension, and abduction and adduction, and the play of all four movements is called as circumduction, and the wrist joint is an example. Then we come to saddle joint. The articulating surfaces are reciprocally concavo-convex. Saddle joint provides for full range of movements in transverse as well as anteroposterior axis, and little movement in the vertical axis. Movements are flexion and extension, abduction and adduction, and partial medial and lateral rotation. Example of saddle joint is the first carpo-metacarpal joint and also sternoclavicular joint. Then we come to ball and socket joint. Articulating surfaces are ball and cup shaped socket. These joints are multi-axial. Movements occur in all planes, that is flexion and extension, abduction and adduction, medial and lateral rotation. Examples of this joint are shoulder and the hip joints. Then the concept of nerve supply of joints and Hilton's law. Hilton's law. The law of nerve supply of joints was stated by John Hilton 150 years back. According to the law, the nerve that supplies muscles that cross a joint and act on the joint also supplies the joint and the skin overlying the joint. Example, the musculocutaneous nerve, for example, is sensory nerve of the elbow joint. It is the nerve of the muscles of the front of arm. The Hilton's joint means sensory nerve, which is supplying the joint, is also supplying the muscles which are moving the joint as well as skin over the joint. Knee joint is supplied by femoral, sciatic and operator nerves, as all these nerves are supplying the muscles which are moving the joint. Nerve supply to joint includes its supply, nerve supply to ligaments, capsule and synovial membrane. Thank you.